Civil Society Alliance for Nutrition Uganda has trained civil society organizations to advocate for nutrition. The training of civil society organizations from across the country involved training on issues of breastfeeding, iron and vitamin A intake, and tips on how to effectively advocate for them. Addressing the trainees at Westminster Village Hotel in Ntinda this morning, Esther Nasiche, an advocate for nutrition and maternal issues, highlighted the need for the best nutrition practices for mothers and children.
That are introduced after 6 months sometimes are not sufficient or they are not the right food. So we talk about ensuring that you have proper, fat feeding practices and you're introducing the right foods for the right age of a child. But also as a mother, you should feed well. And once we talk about a balanced diet, people think it is a balanced diet means you're eating food which is maybe not like usually accessible, but actually within the community you ensure that your diet has proteins, it has carbohydrates, it has the necessary vitamins, and that food in Uganda is really available. You talk about beans, they will give you the iron that you need. You talk about pumpkins, they have so many vitamins that they give you. You talk about potatoes, matoke, you can get the nutrients that you need in the food as a mother. And from consuming that, then you know that the milk that your baby is feeding on will be nutritious enough to keep them healthy and for them to thrive.
Nasiche further appealed to stakeholders to address the nutrition gaps that exist and condemned cultures that deter people from breastfeeding children until they have a name. That means that there is going to be a delay in the initiation of nutrients to children, but then even the education level and empowerment of mothers who lack information.
Sometimes the gap is really in terms of culture, that there are cultures where they say you should not breastfeed a child until the child has a name. But you see there are people who go to the hospital and the child does not have a name yet. So that means that there's going to be delay in initiation of that child to breastfeeding. But then also even the education level of the mothers and the empowerment of the women, that they are not able to make decisions. Sometimes there's a lot of ignorance around how to feed children, that they are not getting the right information from maybe the medical practitioners, or they are also not asking the right questions. So there's a lot of ignorance. I even know educated women who immediately the baby was born, they allow their baby to be fed on glucose or whatever milk, but yet once you inject the baby, even if the milk is not coming in the breast, as you keep supporting them, the milk starts to flow. So all that information is necessary for them to be able to breastfeed very well and breastfeed exclusively. But even
Uganda Health Communication Alliance coordinator Richard Baguma says that the country is facing nutrition-related problems that need an urgent attention.
The capacity building meeting we are having today is to strengthen the ability of civil society organizations who are members of the Civil Society Alliance for Nutrition in Uganda to be able to push for more attention, to push for more resources, to push for better understanding of the challenge of malnutrition that we have in the country, but specifically the challenge of anemia among women of reproductive age and children, as well as the extremely unhealthy levels of vitamin A, that the deficiencies that are prevalent again in women and children and men, but also to promote the uptake, intake, and utilization of this, as well as making it known to Ugandans that the breastfeeding levels of this country are still very low. And
the training emphasized the need for the civil society organization's ability to be able to push for more understanding of challenges of nutrition in Uganda. It also highlighted on the need to work together to avert any possible nutrition crisis.
Nutrition is a very important thing in our homes, when it comes to do with our children, our parents, even ourselves. So because it affects the cognitive, growth of kids. It's not only physical but even cognitive. That's why I got to understand that when you can have kids in primary or throughout their lives, and when they are old, but when they're affected by poor nutrition, that's when you have them, poor performance in schools. They can even become failures in life. So it's a very important issue that is close to our lives, our homes, our relatives.
According to statistics from Uganda Nutrition Action Plan, 60% of the newborn babies are not breastfed in the first 6 months. Joy Nabulo, Church of Uganda, Family TV, News at 8.